All right, let's get right into it. We're going to talk about one of the most common and honestly one of the most misunderstood sounds in the entire world, a baby's cry. But we're looking at it through a really specific lens, when that cry isn't about hunger or a wet diaper, but when it's actually a signal for a true medical emergency. You know, this quote just gets right to the heart of it. It's such a powerful way to reframe things. For any parent, any caregiver, that sound can be incredibly stressful. But when you start to understand it as a language, a direct call for help, well, that changes everything. It's their very first word. And sometimes it's the most important one they will ever say.
And that's the real problem, isn't it? That cry is a signal, absolutely. But it's on us, parents and clinicians, to interpret it correctly. Because when that message is about a serious brain infection, something like meningitis or encephalitis, getting it wrong can have absolutely devastating consequences.
Okay, so first things first, let's start decoding these signals. We're going to break down how you can tell the difference between a cry of just discomfort and a real cry of distress, and what specific signs kick that cry into a potential red alert situation.
Now, this is where context becomes king. See, irritability by itself can be a subtle sign, especially in a tiny infant. It's concerning for sure, but you pair that exact same irritability with abnormal vitals, we're talking a high fever or racing heart, and the whole picture changes. It becomes a high-risk indicator, suggesting the body is fighting something major and a serious infection might be progressing fast. This right here is one of the most specific and, frankly, terrifying signs. Just think about it for a second. A baby's deepest instinct is to be soothed by being held and comforted. So when the exact opposite happens, when being picked up makes them scream more, that is a massive, massive red flag. It's a classic sign that the protective layers around the brain are inflamed and any movement is just agony.
And then we have inconsolability. And look, we're not just talking about a baby who's been fussy for an hour. No. This is persistent, often really high-pitched crying that absolutely nothing can soothe. Not feeding, not rocking, nothing. This isn't just a behavioral thing, it's a neurological sign. It's a hallmark that the central nervous system is irritated and you have to take it seriously.
So, let's build on that idea. We know the type of cry is crucial, but when you start pairing it with specific vital signs, the alarm bells get a whole lot louder. So, what exactly are we looking for?
The key thing to understand here is that these vitals are telling a story. A high fever, of course, that's the classic warning sign. But you also have to look for tachycardia, a really fast heart rate, which tells you the body is under incredible stress. Same goes for tachypnea, or rapid breathing. When you see these things, that irritability is no longer just a symptom. It's a sign that's totally out of proportion to a simple illness, signaling a serious body-wide infection could be taking hold.
And these are the game changers, the absolute must-act-now signs. If you see a bulging soft spot on a baby's head, or projectile vomiting, or a child who's just limp and not really there, lethargic, it doesn't matter what the thermometer says. These symptoms override everything else. They are a direct sign of a crisis in the brain and demand an immediate trip to the emergency room, period.
We've seen the signs that require immediate action. But what actually happens when those signs get missed? What are the real-world consequences? Well, the cost isn't just a medical one. It's measured in life-altering mistakes that end up in huge legal battles.
$27 million. That was the verdict in just one case where meningitis was missed. 19 million. Another case, another family whose lives are forever changed. 10 million. You see the pattern here. These massive verdicts just underscore the sheer scale of devastation when a diagnosis like this is delayed. This table really puts the stories behind those staggering numbers. And just look at the misdiagnoses. The flu, overfeeding, dehydration. I mean, these are common, everyday things that get said in clinics all the time. But in these cases, that simple, easy explanation masked a catastrophic infection, leading to permanent brain damage, hearing loss, lifelong neurological problems.
So you have to ask, how does a mistake of this magnitude even happen? Let's actually break down that $27 million case to see the chain of events and the mental traps that can lead even experienced clinicians down the wrong path.
Okay, so look at how this unfolded. The patient comes in with a super high fever, is extremely disoriented, and literally can't walk. Huge red flags, right? But the clinician immediately anchored on the flu because it was flu season. And here's the kicker. Even when a rapid flu test came back negative, that piece of evidence that went against their theory was just dismissed. So there was no broader workup, no proper neurological exam documented, and the patient was sent home, tragically, to be treated for the flu.
And that case is a textbook example of these common mental shortcuts. There's anchoring bias, where you latch onto the first idea that pops into your head. Then there's confirmation bias, where you only look for clues that prove you're right and ignore anything that suggests you're wrong. And yeah, quitting time bias is a real thing, the pressure to wrap things up at the end of a long, crazy shift. These aren't malicious, but man, they can have deadly outcomes.
So after seeing all of this, what do we do? This brings us to the most important part of this whole explainer: how to empower parents and caregivers to be the absolute best advocates for their child.
Think of this as your game plan. Be prepared. Write down the symptoms, the timeline, everything. Use those specific, powerful phrases we talked about. They are inconsolable, or this is not their normal cry. And then ask this critical question. What are the worst-case scenarios you are ruling out right now? Don't leave if you feel like you haven't been heard. And above all else, trust your gut. You are the world's leading expert on your child. If something feels wrong, you keep pushing until you get an answer you're comfortable with.
After all of this, the signs, the heartbreaking stakes, the diagnostic traps, and the tools for you to advocate, what's the one thing that we absolutely need to walk away with? At the end of the day, it all comes down to this. Every single cry, especially one that is different, that won't stop, that just feels wrong, it's a question. It's a question being asked by a child who has no other words. And as parents, caregivers, and clinicians, it's our job to find the right answer. Because the wrong one can cost absolutely everything.